right, so everybody listening, whether you're listening to us on one of the podcasting sites or the radio, we appreciate you listening. We hope if you're listening to us on the podcasting sites, like, subscribe, share so we can get this out to as many people as possible. We have a returning guest. I believe this is her second or third time on the program, Dr. Mary Talley Bowden. If you haven't heard about her, she is a woman that's really standing up for medical freedom, started an organization in Texas for politicians that are standing up against the jab, and that is Americans for Health Freedom.org. Again, Americans for Health Freedom.org. You can also help her out because she's been getting whacked around by the Texas Medical Board, by Houston Methodist. If you go to givesendgo.com/Dr. Mary Talley Bowden. Again, breathemd.com is her website, breathemd.com, and also on Twitter, breathemd. That's a mouthful, Doc, but it's always a pleasure to have you on the program. You've been fighting for medical freedom for, many years, but especially throughout the 2020s, and we need you as people that are listening to this that are vaccine injured, such as myself.
Well, thanks for having me on again, Rob. It's always fun to talk to you.
Well, it's always great to have you on. I saw you on Jimmy Dore about a week or so back, maybe a little longer than that, and you looked like you were happy. And maybe that was because of what went on with that FDA settlement on Ivermectin, which you were involved in. For people that are just tuning into this for the first time, can you talk about that settlement win? Because that was very huge for you and the many other doctors like Pierre Corey, and the list goes on and on, that were fighting for Ivermectin and still are.
Right. So the FDA launched a smear campaign against ivermectin, and the FDA's role is to approve medications for human use and then move on. Their role is not to tell physicians how to treat certain diseases. Their role is not to tell patients what they can and cannot take for certain conditions. But they did something they've never done before, and they told the public, do not take ivermectin for COVID. And they did this in a very tricky way. They launched a social media campaign, and we all know the tweet with the healthcare worker nuzzling the horse. And you don't really need the caption, but it says, "You're not a horse, you're not a cow, y'all stop it." Well, going forward, ivermectin was then branded as a horse pill, and Joe Rogan got smeared for it. But beyond that, it became nearly impossible for me to get it for my patients. Hospitalized patients were not allowed to get it. People that were suing to get ivermectin, the courts were saying, well, the FDA doesn't allow it. So it had, it was seemingly playful and minor, but it had dire consequences. So myself and two other doctors sued the FDA for overstepping their bounds, for coming between the doctor and the patient. And it's been a battle. The lawsuit started in November of 2022. It was initially dismissed, and it was dismissed on the grounds of sovereign immunity, which basically means you're just not allowed to sue the government. As long as they're doing what they're designed to do, you're not really allowed to sue them. But we proved that they had overstepped their authority. And so we won that on appeal. Then they appealed again on the basis of standing, saying that, well, these things may have happened, but they didn't really affect the doctors. So we barely made it through that. Of the three doctors, I was the only one that made it through with standing. And then we had to, we were preparing for discovery, and they came forward and offered to settle. And so then we had to really debate, how far do we take this? And they were, in their settlement agreement, they were agreeing to do what we asked them to do in the first place, which was to remove the social media posts, to remove the misinformation from their website. And we thought it was too much of a gamble to keep the case going, because they were giving us what we wanted to begin with. And so we took the settlement offer. And yeah, it's symbolic of more than just ivermectin. It's them coming between the doctor-patient relationship, which is, the primary problem with COVID. We had the government interfering with the practice of medicine, coming between doctors and their patients, dictating how to treat COVID, all from the safety of their homes, over Zoom meetings without ever laying hands on a COVID patient. And so we see this win as symbolic. We see it as a permanent stain on the reputation of the FDA. And we feel that, people need to realize that, the same agency is the same agency insisting that 6-month-old children get these COVID shots, right? So we see it as it has discredited the FDA, and are very excited about that. But we have we have 3 years of propaganda to reverse. It's a win, but I still fight with pharmacists trying to get these medications. Right. We still have a lot of work to do to spread the news.
At Breathe MD on Twitter, you put up videos showing the fights you've had with pharmacists about prescribing ivermectin in Texas. And this is happening not just in Texas, but around the country. It's extremely hard to find ivermectin for people that want it, for people that are struggling with this injury that happened in 2021 and 2022 due to a bioweapon. And it's really disgusting. I've ran into this problem, and I do want to get a little bit more into that. But before we go into talking about the bioweapon, let's talk a little bit more again about you. So what happened with you? So the Texas Medical Board, I believe that, and you can correct me if I'm wrong, Doc, that the case went to court at the end of April. Can you tell us what's going on with you and the Texas Medical Board right now?
Well, it was supposed to go forward a couple weeks ago, and then it got postponed. It's been complicated for even me to follow, but there's been all sorts of back and forth. The judge has issued 13 pretrial orders. And basically, they're trying to keep me from having an expert witness, and they're trying to push through their expert witness without letting our side depose their expert. And then they brought on another judge. I'm not sure why. And then the second judge finally ruled that yes, we're allowed to get an expert, but now the trial has been postponed until September or October. And this started in November of 2021. It's a political witch hunt. It is not about patient safety.
No.
And if it were about patient safety, they wouldn't drag it out this long. But no, they're just trying to win their political cause.
So what are they trying to do? Milk the clock so that you have to pay for the lawyers, month after month, year after year. So they just basically they're trying to bankrupt you, it seems like. Maybe you have a different interpretation on that.
Right. I mean, the process is the punishment. So it's the legal fees, the cloud of stress. I can't apply for privileges while I have this ongoing issues going on with me, with my medical license. I don't know that I can hire other doctors, or I'm not employable. It's more than just a lawsuit. It has a lot of and my reputation. If you Google my name, it's it looks like I'm should be put behind bars.
Yeah, I did that this morning, and we know each other, but I still did it just for kicks this morning. And there was some very sketchy stories about your personal life, and I'm like, dude, who cares? And and then I see all these other reviews, 4.6, 5.0. So I don't give a damn what's going on in the doctor's personal life. I care about what they're doing with their patients. And if you're getting 5.0 reviews out of 5, I want to go to that doctor. I don't want to go to the doctor that's getting a 1 or a 2. So it's just really sad that they're trying to destroy your reputation because they were making money off pushing a product that didn't work, that injured people, that murdered people. I know that's another story for another day, but I want to kick this around too, because you had another case that I believe was dismissed in 2023 with Houston Methodist Hospital. And I know you came on the program before and spoke about what happened there. Is that case over now that it was dismissed? Or are you still fighting that?
I'm still fighting. It's on appeal. We're just waiting for a decision from the judges on that case.
So what is going on where we thought, and I feel like we spoke about this before, that Texas is a supposed conservative state. I know that the medical establishment in Texas, rather, is very much blue. And I hate that we have to bring politics into this, but it seems in the time of COVID-19, it is about politics now. They didn't make it about health, they made it about politics and making money. So, with that said, why are these judges that are supposedly conservative, supposedly stand up for freedom and democracy, they don't care about somebody like you that was standing up for what was right with the patient, a patient that passed away. You're standing up what is right for many other patients, treating patients that had COVID-19, treating patients that were injured by the bioweapon. They just don't give a damn, I guess, or maybe they're paid off too, the judges as well as the medical establishment.
Right. And yeah, I don't know as much about the judicial system with Texas. I have looked into
Okay.
the political system, and despite the fact that we are dominated by Republicans in our Congress, in our House of Representatives and Senate,
Mm-hmm.
about half of those representatives really aren't what you would think they are in terms of,
Yeah.
at least with medical freedom. I mean, there were 11 medical freedom bills that were up for debate, and only 3 of them passed, and one of them barely passed. It was after 3 special sessions. And we just have I think I'm very passionate about amplifying the voices of the people that are strong enough to fight fight for medical freedom, because it's a rarity. And you're going up against big pharma, you're going up against billion-dollar hospital systems, and it takes strength. So I'm passionate about supporting the politicians that will fight that fight.
Well, Bob Hall is a guy in the Senate over in Texas that's done some great work, I know, on medical freedom and talking to Texans for Vaccine Choice and that group. And I know you've done some interviews with them and worked with them, and they're doing great work. So there are some people in Texas. Ken Paxton, obviously suing Pfizer. Look what they did to him after he did that. They tried to impeach him. I never even heard of any kind of that happening to a person that was an attorney general. Maybe a governor, maybe a president, obviously, but not somebody that's an attorney general. So you go after the cash cow, and that's what you did. You went after the cash cow. They wanted people to take the ventilators. They wanted people on the remdesivir. They didn't want people to stay alive. They wanted people to take the shots too. And you pushed against that. And they said, we're going to destroy you. We're going to destroy Ken Paxton. We're going to destroy whoever steps in our way. And that's the way the cookie crumbles in our society. And God bless you for standing up for freedom, for, again, people that just want a good doctor that's going to stand with them, that's going to give the Hippocratic oath. I feel like in medicine is gone, Doc. I mean, I don't know if you agree with that or not, but some of these doctors I've been laughed at, made fun of in my face because of my injury, and they don't care about you. They don't care about what's going on with you. They don't ask you about your lifestyle. They just want to pump you with pills and make you take the next jab.
Yeah, it's I mean, I see a lot of patients that have lost faith in the healthcare system, and it's understandable. And I think the most common question I get asked is, who can you recommend? Who do you trust? Where do I go if I have to go to the hospital? So we're gathering names and growing a network, but it's hard. And part of this problem is that most physicians are employed. They're employed. Their paychecks do not depend on the patients. Their paychecks depend on a hospital or United Healthcare is the biggest employer of physicians in our country. So it could be a hospital, it could be an insurance company, it could be the government that they're working for, but their best interests are not necessarily the patient's best interests. They've got somebody whispering their ear, telling them how to treat patients.
For people listening or watching this, we had a little bit of a snafu. We are back here again with Dr. Mary Talley Bowden. Again, it's at BreatheMD, breathemd.com. And you can also help her out at givesendgo.com/Dr. Mary Talley Bowden. And again, her organization, which we're going to be talking about right now, is AmericansForHealthFreedom.org. Again, AmericansForHealthFreedom.org. Doc, obviously, the Texas primary was a few months back. There was some very good wins for the medical freedom side in that Texas primary. And the runoffs just finished off in May, or they're about to finish off, I guess, in May, we should say. So can you talk about this? Because obviously it involves your organization, Americans for HealthFreedom.org, but just specifically in general, since you're in Texas, can you talk about, the good wins in the Texas primary?
Right. So this started about 6 months ago. I just stumbled upon a representative in Michigan, Brad Paquette, who is vaccine injured and posting about it on X. And I asked him, would you be willing to publicly state that the COVID shot should be pulled off the market? And he wholeheartedly responded yes. It gave me the courage to ask more people. And now our list is almost up to 300 people. So it's a mixture of people in office and running for office. We have a wide range of power positions. So we have precinct chairs and school board members, but we also have Marjorie Taylor Greene and Senator Ron Johnson and Thomas Massey. We have the Florida Surgeon General, Dr. Latipo. And yeah, Texas, I didn't realize how hard it is to unseat an incumbent. It's exceedingly hard, but we did have some wins. We still have a lot of races that are in the runoffs, and that's on May 28th. So I keep a running list on my X account, and then the website is also AmericansForHealthFreedom.org. But I would encourage everybody, even if you don't live in Texas, if you can spread their name far and wide on social media, that helps them. That actually helps them raise money for their campaign, because they get money from X for advertising revenue.
Oh, wow.
So it doesn't take much to contribute. It's very important. I'm very frustrated because most of the politicians don't really want to talk about COVID. They've moved on. Yeah. And that is unfortunate, because the next pandemic is just around the corner. Right. And I want like-minded people that will fight this time and not cower and not, not question. I'm not saying that, we have to ignore everything that comes out of the public health agencies, but we should at least approach it with skepticism and critical thinking, and listen to a wide range of opinions, not just a few in power who don't actually treat patients.
Well, listen, I think COVID is the most important issue in this upcoming election. They took away your freedom. They forced you with mandates. You lost your job. You lost your businesses. You got a medical, and I'm trying to think of the correct word, a medical jab. For some people that they trusted the government, they trusted their doctor, they trusted their politician. The jab comes in, they either got injured, they died, or maybe if they got lucky, they got a placebo. With that said, that should be the most important issue, because as you just stated, it's just around the corner, the next pandemic. They're going to try this again. And some people, maybe they just don't care about freedom. That's what I've come to think, Doc, is that a lot of people prefer to be told what to do. They might voice that they're for freedom, this and that, and all this nonsense, but they love being pushed around by big daddy government and just following the leader. There's not a lot of leaders in this country anymore. There's a lot of followers. And we are grateful, again, for doctors like you that are standing up against the establishment narrative. And you've been standing up with this before it was cool to stand up for this against this establishment narrative. And you know what? It's really sad. And I'll end this point on this. We had a really great candidate for president of the United States that I voted for, Governor Ron DeSantis, the governor of my great state of Florida, stood up against the jab, still standing up against the jab, put Joe Latipo, who you just spoke about, in a health position as far as Surgeon General for the state of Florida, and is pushing against the narrative of the jab. And we have instead a person as a nominee that has pushed the lockdown, still pushing the jab, and he is just singing the same old song, just to a different beat. And it's really ridiculous. But you know what? The American people get what they deserve. I'll say it. You don't have to. And it's really disgusting. So I'm going to vote for Robert F. Kennedy Jr. because he's the only one that's standing up against the jab, for medical freedom, excuse me. And that's the way it's going to go for me. I don't agree with everything he says, but I agree with the majority. And we need to vote for somebody we don't follow like a cult leader. We follow this person because we believe what they believe. We don't follow these people because, all these people are following this nominee of the Republican Party because they think he's Jesus Christ. And it's really disgusting. I can't, I'm sorry, I can't do it anymore. I'm not playing that game anymore. So anyways, we'll move on. So, speaking.
Well, I will
Go
say
ahead.
one thing that is inarguable is COVID directly affected every single voter.
Right.
And I just don't see how it's not the number one topic, right? It should be the number one topic, as you said. But no one wants to, move on. And one thing that I do when I'm looking at a candidate is I go back on their social media posts. I do a little search. I look for COVID and I look for vaccine. And if they're running for office and there are no posts that they've never posted about those, that either means they have no interest in the topic or they have scrubbed their account because they don't want us to see what their positions were. And it has been very revealing for a lot of people. And that's my first step if I'm going to endorse somebody is look at what their positions were during the pandemic, because it is a litmus test, right? If they, it's one thing to make the wrong call early on. I can forgive that.
Right.
I mean, very few people got it right from the very start. But if they, haven't reversed their course or being very quiet about it, I think that is telling.
I saw Governor Ron DeSantis running around the state of Iowa, South Carolina, New Hampshire with Representative Thomas Massey, Representative Chip Roy. All are against what happened in 2020 and the lockdowns and the jab, just to say that, just so we can get this on the air. And who you hang around with, Doc, is how you should be judged. The Republican nominee right now for the election hangs around with a lot of bums and a lot of rhinos. The person that we could have had that's done great things in the state of Florida against the trans agenda, against abortion, against the jab, the list goes on, saving our kids in schools. We couldn't have him because we have these people in America that believe in cults. The people on the left of the jab cult, they believe in all kinds of other nonsense too, that they're cultish. And then we have the people on the right that are in the Trump cult. And apparently in America, we can't have nice things. And that's just the way it's going to go. And again, we turn to people like you. We turn to people like Dr. McCullough. We turn to people like Dr. Malone, Joe Rogan, people that have been on the side of freedom and in the media for quite a few years now. And that's who we're going to stand by. And like I said, whoever listens to this, whatever they think about RFK Jr., that's whatever they think. But I'm going to stand with the man that's standing against this, and that is for health and not making people sick and having people work out and having people eat clean food, clean soil. The list goes on. That's a person that's for better America, excuse me, not these other bums that just want America to just continue on into this destruction narrative. So,
yeah, I could not agree more about DeSantis. All action. I mean, during the pandemic, Texas was always lagging 3 steps behind Florida. It was like DeSantis would do something and then Texas would follow in its footsteps. But he was a leader during the pandemic. He got things done, right? And is very disappointing that he's not one of the nominees.
Yeah. And he was a veteran. He served this country honorably as a soldier. And again, we have people in there that are just a bunch of nonsense. Their reality TV show used car salesmen. I'll get off my horse because I've just had enough of this. is high school stuff that's going on in this country. Anyways, we'll move on. So, we talk about the injured. I'm personally injured. You know that. I talk to a lot of people that have been injured by the jab, and I see two things in common, Doc. Sky high inflammation in their bodies and autoimmune issues after the jab. What are you seeing? Or are you just seeing these kind of specific things? Because I know obviously it's a big pool and everybody has different symptoms, but I'm talking about these two symptoms I see with everybody I speak to in common. And obviously they have other symptoms also.
Right. I definitely think there's an autoimmune inflammatory component as sort of the big picture with these injuries. And more specifically, I see rashes, which is a manifestation of severe inflammation. I see unexplained pain where there's nothing you can find anatomically, but there's just having severe, a nerve inflammation.
Right.
I see, cardiovascular inflammation, which manifests as, erratic changes in blood pressure and pulse, or inflammation around the heart or the chest wall or around the lungs. So I agree. I think, we're looking at this autoimmune inflammation as sort of the underlying overall big picture problem. And, I know, it's hard to eradicate, right? I mean, I'm seeing improvements in people, but the symptoms tend to fluctuate. They tend to be ongoing, and they tend to be, difficult to treat.
Yeah. Listen, I have that same thing with the nerve inflammation in my trap muscle. They've done dry needling. They've done cupping. It helps. Obviously, it's not an end all be all. And, that's the way the cookie crumbles. Obviously, we learn from our mistakes, from being brainwashed. And I was in that cult-like state, in that liberal hysteria that I call, back in 2020. I've learned from it. I've grown from it. I'm grateful that I've grown from it and seen the light as far as politics, as far as what's going on in the country in general. Otherwise, I could still be taking jabs and living in this fake liberal fantasy, like a lot of these other college kids running around in all these silly universities around the country. So I do see that a lot. When we talk about autoimmune issues, and I know you just talked about it, people get better, but it's not end all be all. Is the autoimmune issue curable? Because I'm talking to a lot of doctors and they're telling me that if you don't get that autoimmune issue taken care of, it could eventually lead to a cancer.
Yeah, I wouldn't, I haven't seen, I have not seen vaccine injured patients where they started with just typical symptoms of autoimmune inflammation and then it became cancer. So I can't, clinically, that's not what I'm seeing. But I guess it's possible. But
I also
my
asked
start.
Doc to just interject quickly, and I apologize for interrupting, is because we're hearing a lot about these turbo cancers too, that just young people my age, even younger, they just wake up one day and they're at stage 3 or 4 and, they're up, craps creek in plain English.
Yeah. And so I'm not seeing that in my office, but
Okay.
I do have a good friend who works at MD Anderson, and she has said that she's seen younger and younger people come in. She's an anesthesiologist, and she's seen, much younger people coming in with more advanced cancers than she's ever seen.
Yeah. It's truly sad. You just think some days, and I wake up as a person that's injured. What happened to this country? I was born in 1989 and, growing up in the 90s, and it seemed like it was so much, relaxed in the 90s. I know we always have our problems in this country, but it seems like it was just like people weren't insane. People weren't, acting crazy in the streets as much as they are now. The mental health crisis is out of control now. People are just really off their rockers. And it seems like it was a lot simpler time in the 90s and the 80s. Obviously, like I said, we always have our problems, but it's just not like it was back in those days. Just ending with the last two questions. what type of people do you feel like are still getting the jab? I know there's not as many people getting the jab, but I'm walking around, even in Florida, seeing more people with masks on. I went up to Rhode Island, where I'm originally from, seeing more people with masks on. There's people still talking about getting the jab. What type of people are we dealing with that is still doing the masking and the jabbing?
I know when I see people wearing a mask, I mean, to me, it seems like a sign of mental illness at this
Right,
point.
right.
So,
But what about
but
the,
yeah, I
I
haven't
mean,
had a
we're on to
personal
nine or 10 shots. I mean, when are we
yeah.
going to stop taking this? And is it these
Well,
people that are just scared of
even
their own shadows? Go ahead. I'm sorry.
even scarier is who are the doctors recommending that patients continue to get 9 shots? I mean, that's unbelievable.
Listen, I don't trust the person with the white coat. I do trust some few people such as yourself. And there's a few in the cookie jar that you, excuse me, still can trust. But the majority of the people wearing the white coat, men and women, they're just looking for the payoff. They're just, abiding by the insurance company, abiding by the person that's hired them because they mostly don't have their own practices for that, sake. So you got to look at these people and say, hey, listen, make your own decision. These people are not looking out for your best interest. If they were, I would come into an appointment for, I'm sure that you do this. You come into the appointment with the patient, you say, hey, listen, Rob, how you feeling today? Are you working out? What are you putting in your body? The list goes on and on for the questions. It's a 5-minute appointment with as far as a doctor's visit, and it's an in and out. And they're looking at the computer. They're not even looking at
Mhm.
your face. How can you know what's going on in my life if you have me in an office for 5 minutes, don't even look at me? Maybe you'll give me a couple of touches to do my blood pressure or something, and then you throw me out the door. And the first time I say, like, maybe I'm not feeling good, you go right to the pills. Don't ask me if I had a life changing event in my life. You go right to the pills. And I can't tell you, and I'll shut up and end with this, Doc, how many times I've been to a doctor and I tell them about my injury that it happened 2 weeks after I got the vaccine, and they go right to it's long COVID,
Yeah.
that it could never happen with the vaccine. It's safe and effective. We've never heard of this before. Well, maybe you should just open your eyes and look at other books, look at other TV programs, look at other research papers than just the medical establishment. Open up your mind. They don't want to do it. They
It,
don't want to look into the book.
it's truly unbelievable, really. I mean, it's mass formation psychosis, I
Right,
guess. I mean,
right.
it has captured their brains.
So we'll end with this question, leave the audience with some hope because it just seems like since 2020, it's been death and destruction. Even if you don't have an injury, somebody that has an injury. If somebody in your family hasn't passed away, somebody that's a friend or a family member that has passed away. So leave the audience with some hope because, again, as you stated, they're planning another pandemic. They're switching every vaccine to mRNA. They've went psycho crazy in this country and around the world, this medical establishment.
Well, I believe the pandemic was a war, and we have to keep in mind that wars are not. It takes time to win a war, and I feel like the position is changing. When you look at the time it took from the Constitution to pass to the First Amendment, it was 6 years. So we're in the fourth year, and we're starting to win. I believe. I mean, we put the FDA back in their place. We've got Brooke Jackson's lawsuit, and if that goes through, that could bring the house of cards down. That could bankrupt Pfizer. It could really change the momentum of our war. We have, inklings of mainstream media starting to show signs of intelligence with, Chris Cuomo. we have very few. I know there are people out there masking and jabbing, but the majority are not. And we have elections coming up, and I agree with you on Trump. It's very frustrating about his stance on these shots. I think he's probably going to end up our president. That I know, but that's just that because he's got such loyalty. I mean, people are so loyal to him. But I mean, hey, it's better than Biden, right? So if he appoints some good people, then that gives me hope.
Listen, I'll just say this: these people that again are very cultish with Trump, they, as you said, as a Christian, I believe in what's said in the Bible. We talk about Revelation, we talk about the Antichrist. I'm just saying that Trump seems like the fit for the Antichrist. I know that's not going to go over well with people that are listening to this, and they're going to, pout and stamp their feet. But I'll tell you what, these people are loving Trump. Again, as he said, he can go on Fifth Avenue and shoot somebody, and he just gets away with it. Again, I think that the stuff they're doing in New York as far as the trials are a complete joke. I think that woman, Stormy Daniels, is a joke. I think all this stuff, they're trying to make him not president. That's why they're bringing this stuff out. But instead, it's the opposite. They're going to make him become president again because these liberals are just dumb as a box of rocks. They're just in, again, this liberal hysteria by themselves. It's just really as much of a joke. So we have, again, ending with this. The Republicans, are in the Trump cult, and the liberals are in some kind of liberal fantasy with Ukraine, the trans agenda, the jabs. I mean, I don't want to be a part of any of these people. I'm sorry. I'm done with this junk. And I'm a person that loves politics, but I'll tell you, I haven't watched any of this political nonsense the past year. No CNN, no MSNBC, no Fox. I'm done with this stuff because you know what? In the end, these guys are in here for 4 years. And as you're doing with what you're doing right now with your group with Americans for Health Freedom.org, it's about local elections. And you're getting a lot of these people. Some are national, but a lot of these are local people. And these are the people that shut down the states. They shut down the counties. They're the ones that are involved in these mandates, and they can buck against the national congressmen, the senators, and the president. And these are the people we have to put in power, the correct people. And if we don't do that, we'll be stuck with what we had in 2020. So I'll end there. But again, Doc, thanks so much for doing what you're doing. It's always a pleasure speaking to you because not only do we believe in the same thing as far as medical freedom, in politics, I believe we're very close too. And I'm grateful to talk to a doctor that's mentally sane instead of the doctors I speak to daily that are mentally insane. So again, for people listening, Dr. Mary Talley Bowden, again, at BreatheMD on Twitter, breathemd.com. And again, it's AmericansForHealthFreedom.org, AmericansForHealthFreedom.org. And if you want to help her with her lawsuits, it's GiveSendGo.com/Dr. Mary Talley Bowden. That's a hell of a mouthful, Doc, but it's always a pleasure to have you on. Thanks so much for doing what you're doing.
Thanks for having me, Rob.
While we would all love to leave COVID-19 behind, the virus is still here and making some people very sick, especially older adults. The new updated COVID-19 vaccine is the most effective way to give your body the ability to keep the COVID virus from causing you harm. That's why CDC recommends everyone 6 months and older get 1 dose of the updated COVID-19 vaccine ahead of the fall and winter season. This recommendation was based on extensive data and clinical trials. As a doctor, a mom, a wife, a daughter, and head of the CDC, I would not recommend anything to others that I wouldn't recommend for my own family. That's why my 9 and 11-year-old daughters, My husband, my parents, and I will all be rolling up our sleeves to get our updated COVID-19 vaccine. I encourage you to get your own updated COVID vaccine and make sure everyone in your family who's 6 months and older does so as well. Don't forget, it's also a good time to get your flu shot if you haven't already. Check vaccines.gov to find a location near you and get your vaccine. And if you have any questions about the vaccine, please talk to your doctor.